You know, my gynecologist tells me HPV, HPV. All he does all day long is call women and tell them they've got HPV coming back from all the pap smears. And this like came out of the blue. I mean, you know, nobody ever heard of this before. All of a sudden, it's everywhere.
It is everywhere. The problem is that the women get tested for it, but gay men do not get tested for it, and the gay men have a similar rate of HPV as women do.
Let me ask something though. Where do they go to get tested? Would you go to a gynecologist? I mean, where do guys go? Who would test them?
That's the problem. There's a lot of gynecologists, and there's very few people who do testing males for HPV.
What does it entail? I mean, what is the screening procedure? I know for women, you know, you go for your pap, it comes back, it's either negative, positive, they show cell changes, whatever. What do men do? What would you do to screen somebody?
Same exact thing. We have the same pap test, exactly the same thing with the brush. It revolves around how many cells you have that are not exactly normal. Also, how much HPV you have and what type of HPV you have. You can have a high-risk HPV or a low-risk HPV. And the pap test in males will tell you that.
The same thing, from what I understand, from what I've seen, it's the same thing with the women.
Same thing with women, same thing. Problem is that men do not go for this because there's very few people that are willing to treat this, very few doctors that will treat this. So why go for something that you can't be treated for? That's the problem.
Well, let me ask you this. So you get your pap smear in the anal area, right? Is it more, when it's in the anal area, is it very uncomfortable? I mean, I know pap smears are never fun, but I mean, is it painful?
It seems to be painful because you got to get the cells. See, so it's painful. It's a brush, but I noticed that when I do the test, I haven't done it on myself yet, but most people say that it's painful. But it's just about 10 seconds of pain.
Yeah.
That's it, you know. It's actually a brush that you have to brush the skin and get the cells out.
Huh.
So you have to cause some pain, and there are pain fibers in the rectum.
Wow.
Yeah. So that's so it hurts a little bit, but it's worth it. It's a test that we have to do.
Well, that's it though. See, now with women, it's been so drummed into everybody, cervical cancer, that, you know, you get your, I mean, I go twice a year. I know people that go once a year. What kind of outreach are they going to do for gay men to say, you know, this is something you have to do once a year? Do you see people jumping on the bandwagon with this? Or do you see them just blowing it off, you know?
I see them blowing it off.
Because I know Jimmy, you know, the first patient was like, you know, it's one more thing to think. I mean, he was funny, but he's right. It's like, how many things can you get tested for, you know?
Shocked, yeah. No, most gay men have no clue about this, that this is a disease. And the fact is that the rate of cancer of the in the rectal area in men is it's hundreds of times more than females in the cervix.
Yeah, I read.
Yeah, so that's the problem. The disease is treatable, but you have to treat it.
There is a treatment, isn't there?
There is a treatment.
Okay, so
absolutely.
What does it entail?
It's exactly colposcopy, the same thing you would do for a woman, exactly the same thing.
Can you explain it a little?
Colposcopy is you have to put a light and a camera into the anus.
Lights, camera, action.
Yeah, wow. That's what happens, and you stain it, and fortunately, abnormal cells do stain differently than normal cells, and it's a very simple test. It's a white vinegar. Very simple. Just the same thing we do with and you see the abnormal cells. What you're supposed to do is take a biopsy first and then treat afterwards. You can treat a number of ways. The same thing with the cervix. You can treat it by cauterizing it.
Yes, that's.
Or you can treat it by using an acid on top of the lesion. Every treatment requires follow up.
Okay, but the follow up is essential then.
Absolutely essential.
Because it's like they say with cervical cancer, if it's treated early, it's one of the most treatable.
It's absolutely right.
But with anal cancer, is that the same thing? Same thing.
Absolutely the same thing.
So the early detection is really
That's
critical.
What counts, yeah.
Huh. Now, what about the Gardasil for men? Because, you know, you're reading a lot about, you're following that, right, with the vaccine?
Yeah.
You know, first of all, they're only insuring women 11 through 26 years old. Like nobody has sex outside of that group, you know. I mean, but is that going to be an option? Because you don't hear about Gardasil in gay men.
You don't. I personally am for vaccinations to everybody, but the insurance companies are not. Unfortunately, they're not that way. they're probably right that most of us already have the virus, and if you have the virus, it's too late. You can't. The vaccination won't work.
Right.
So the insurance companies will not pay for it. It's not that expensive. It's also not that risky. So why not take it? You know, that's my feeling about it. But I'm not running the insurance companies. So.
No, and we wish we did. Don't we? So let me ask you then, what would you tell people as far in terms of how to guard against this? How can you protect yourself against HPV? Is it possible?
Very interesting. Is it possible? It's difficult. That's why we all have it. Gay men, most of us have it. Condom does not prevent getting it.
Well, what would do it? Just complete abstinence? Which,
Well,
yeah, that really works.
it
doesn't work anywhere.
That's not an option.
They tried with the heterosexuals too. It's not happening yet.
Is that an option?
Okay, so
most of the time,
yeah,
it's
that's
also,
done.
It's
That's
also
done.
skin-to-skin contact, so it's not necessarily sexual. You could have contact with somebody that's not. For example, I'm a doctor, so I touch somebody. I touch people all over the place. If I would touch the person in their skin and I would touch myself, I can give myself the HPV virus, and that's exactly what happened. I did do it.
Wow.
I did it. That's
You
exactly
did
what
it?
happened. Yeah. Yep.
So you have HPV now?
Yeah. Yeah.
Really?
Exactly. Yeah.
So you sure you have it?
Yeah. Yes.
Oh my God.
Yes.
So if we have anything to tell people on a more positive note or a hopeful note, what can we say to them? They can call your office.
Yes.
Okay. And
You should be screened, like I should be screened, yearly.
your office will do this, and if they call you, you can tell people where to go.
Absolutely.
All right. So they're all
Absolutely.
screening.
Absolutely.
All right.
Absolutely. Yeah.
Okay. You know, that's just funny because it's like anything else, I guess, any other virus. It just kind of came out of nowhere. Do you see HPV becoming another HIV?
Absolutely.
You do?
Absolutely. It's got to be looked at. We all have to be looked at.
All right.
We
Very
all have to
interesting.
be looked at. All of us.
You can't say this enough. No,
Can't
it's
say
true.
enough.
Okay.
So,
Dr. Joe, thank you.
thank you. And we have the end of our statement is always be aware, be healthy, and be safe.
Thank you.